Hi there, it's Natalie, your wellness consultant, and welcome to another episode of Wellness with Wisdom. Today we're going to talk about natural options for pain management, and I will of course begin with a little bit of an explanation on what pain really is, what it means, and ultimately how to manage it appropriately in a natural way. Now before we dive in, here is my friendly reminder. The information we provide is not intended to be a substitute for medical treatment. Please consult your medical care provider before using herbal medicine, particularly if you have a known medical condition or if you are pregnant or nursing. If you are worried about any health condition, it is always advisable to have a face-to-face consultation with a qualified healthcare practitioner in order to obtain a diagnosis and treatment advice. So what is pain? So pain is an unpleasant sensation and can be an emotional experience that links us to tissue damage. It allows the body to react and prevent further tissue damage. Pain can be steady, throbbing, stabbing, aching, pinching, or described in many other ways. Sometimes it's just a nuisance, like a mild headache. Other times, it can be debilitating. Pain can bring about other physical symptoms like nausea, dizziness, weakness, or drowsiness. It can cause emotional effects like anger, depression, mood swings, or irritability. Perhaps most significantly, it can change your lifestyle and impact your job, your relationships, and even your independence. People feel pain when a signal travels through nerve fibers to the brain for interpretation. The experience of pain is different for every person, and there are various ways to feel and describe pain. This variation can, in some cases, make it quite challenging to define and treat pain. Pain can be short or long term and stay in one place or spread around the body. Pain is classified as either acute or chronic. Acute pain is usually severe and short-lived, and it's often a signal that your body's been injured. Chronic pain can range from mild to severe. It's present for long periods of time and is often the result of a disease that may require ongoing treatment. So let's talk a little bit about some surface or topical treatments for pain. And I'm going to start with one that most of you, I'm sure, are quite familiar with: heat and ice. Among the most common home pain remedies is applying heat and ice directly to the sites of pain. While this treatment may seem obvious, not everyone's clear on exactly when to use ice versus heat. So applying an ice pack to reduce swelling and inflammation shortly after you experience a strained muscle or tendon or ligament may bring relief. Interestingly though, once the inflammation has disappeared, heat may help reduce the stiffness that comes with sprains and strains. So you want to transition from initially the cold ice to the heat as you get the swelling down. So remember to do that and you'll be less stiff the next day. A cold pack used briefly on the head may also help to take away the pain of a headache. Now, if your painful problem is arthritis, moist heat applied to the affected joint will help more than ice. So you can get moist heat packs, and they can be warmed in the microwave or in the oven, and you can reuse them many times, and that also makes them very effective for multiple use. So I'm going to give you an example of a moist heat pack, and that's something called a castor oil pack. So castor seeds contain something called ricinoleic acid, and it's a major component in castor oil and has analgesic properties, so pain relieving properties. So essentially what a castor oil pack is that you're taking a piece of wool or cloth and you're soaking it, completely saturating it with castor oil. that is essentially your pack. And ideally, I recommend warming the oil and then saturating the cloth with oil and then applying it. So how do you use a castor oil pack? So you lay down a large towel or a sheet so you can catch any castor oil drops, because it can be kind of messy. Then you place the castor oil pack, so that saturated cloth, over the area to be treated. So for example, if you have pelvic pain, you bring it over your pelvis. If you've got, if you've pulled a muscle in your thigh, then you're putting the pack over your thigh. So directly over the area that is giving you the most discomfort. Then you place a small plastic sheet over the castor oil pack. So this helps to keep the heat in and helps to press it against your skin. Then you can place a hot water bottle or a heating pad on top of the plastic for more heat if you wish. Now make sure you don't fall asleep while heating the castor oil pack, because that can lead to burns and other kinds of injuries. Okay, so you leave the pack on for about 45 minutes to an hour. Just relax, chill, read a book, watch some TV, just lie still for about that period of time. Then you remove the pack and you wipe the area clean with a warm, damp towel. And you, as I mentioned before, you can store the castor oil pack in a container. In the same container you used to soak them in, and then just keep it covered and refrigerated. And then when you're ready to reuse it, you would just warm it back up again. And you can do this up to 30 times. All right, so that's quite helpful at giving you topical, right at that moment, pain relief. Another option is apple cider vinegar. A lot of people find that is also a very familiar topical pain reliever and very good for swelling and sprains. Similar idea to castor oil, except that you're not warming the vinegar. So essentially you would take a cloth, saturate it with the vinegar, wrap the area that is injured or inflamed, and then leave it on. In this case, normally with apple cider vinegar wraps, you want to wrap the area and leave it on overnight. Okay, and then you would just wash it off in the morning, and that will also help with relieving some pain topically. Okay, next we're going to talk a little bit more about topicals, but now more in the category of rubs, topical lotions, gels, creams, that kind of thing. I'm going to give you a little bit of an idea as to what types of active ingredients you want to look for, because these are ingredients that are supported by research, and we know that they're going to do what they say they're going to do. Alright, so number one on my list is Arnica montana, and it's actually a flower. It looks a little bit like a daisy. In fact, it is part of the daisy family, so keep in mind, if you have an allergy to daisies, this is probably not something you want to apply to your skin. Okay, so Arnica has been shown to be quite effective in relieving pain and inflammation in muscles and joints, and especially for people who have osteoarthritis. There are even research studies to support the substantial relief in pain in knees and hands. So some clinical studies to support that. So you really want to look and see if you can find a topical that will help with those particular types of pain. You want to see that Arnica ingredient in the mix there. Alright. Okay, next are some essential oils. So essential oils are, as they are by their names, they're oils that are extracted from plants, and essential means that they're undiluted, so they're like the very concentrated form of the oil from the plant. And the first one I'm going to mention is peppermint. Peppermint's really cool. Peppermint oil is antispasmodic, so that means it works on spasming pain. So for example, menstrual cramps. So very effective for that. And there's even a form of peppermint oil that is safe to take internally, which even helps with spasmodic pain in the intestinal tract. So for people who have IBS, Crohn's or colitis, when they get these spasms of pain in the intestinal tract, then the peppermint oil can actually help to calm that and soothe the pain pretty quickly. So this is one of those things that you can apply topically, and there are safe versions to ingest to help with spasmodic pain internally. Also, peppermint oil is quite helpful for headaches applied to the temples. It helps with it's soothing and relaxing, and peppermint oil is very good for blood flow and circulation. Okay, so it helps to reduce blood vessel constriction. Lavender essential oil. Also, inhaling lavender essential oil helps with relieving pain. especially pain associated with migraine type headaches. Because lavender essential oil relaxes the central nervous system, so it has a calming effect, and that then helps with relieving pain. In fact, I like combining peppermint and lavender when people have migraine headaches and applying it topically, and then reminding them to sit still and breathe deeply so that you can get the aromatherapy benefit. So just chill for a minute, don't just rub and go. All right, so if you do have those types of headaches, then try the peppermint oil and the lavender oil applied topically to your temples. Also, you can apply it to your solar plexus, which is kind of in the center of your chest as well, and then sit still and breathe. Eucalyptus oil. Lots of people know about eucalyptus oil. It's a great one. If you're inhaling, it helps with decongesting. But eucalyptus oil topically is fabulous for pain relief, and it also has anti-inflammatory properties. And again, with eucalyptus oil, when you inhale eucalyptus oil, it actually helps to modulate your blood pressure via your nervous system. So it relaxes your central nervous system and your autonomic nervous system, so that relaxation relieves tension, which then can have a positive effect on our pain management. And then as well, the eucalyptus is giving us that topical pain relief as well, because it is also analgesic, so it kind of does a double duty. So if you're very stressed, in fact, for example, if you've had a very severe injury, or if you've just had surgery or anything very severe or intense, inhaling eucalyptus oil is going to help, and can be used in conjunction with any other anti-inflammatory medications that you may be using. Inhaling the eucalyptus oil is going to help it work that much better. All right, so keep that one handy. I'm a bit of a klutz, I always have it around. Okay. And the next one is clove oil. I've used this myself a lot. I know even a lot of dentists use it, because clove oil is a natural analgesic, so it's like an anesthetic. In fact, it is. When you apply clove oil directly to tissue, it deadens the tissue, so it blocks the pain within seconds. So you can apply clove oil, so put a little bit of clove oil on a Q-tip and then apply it along the gum area wherever there's a toothache, and you will see pain relief down to the nerve ending within seconds. It's not the tastiest thing in the world, but it is quite effective. Also keep in mind, clove oil has a very, very high antioxidant rating, like crazy super high, and it also has antibacterial properties. So clove oil does double duty. It's not just palliating the symptom of pain, it is addressing the underlying condition. So if, for example, the toothache is as a result of infection, then the clove oil is also going to help with killing off any of the bad guys, the bacteria that may be causing the infection, so it can help to speed the healing as well. So fabulous single ingredient for pain management and also addressing underlying conditions. Now I have one more topical, and this is more of an application, functional application, and that's acupuncture. So acupuncture is essentially when they're inserting very tiny, thin needles through your skin at strategic points on your body. It's a key component of traditional Chinese medicine, and acupuncture is most commonly used to treat pain. It's even very increasingly been used to help with general overall wellness, and including even stress management. So acupuncture can be used with other types of pain management to help us be more successful at regulating pain. It is efficient. There are clinical studies to support this as well. In various types of treatment, acupuncture can be added in as some sort of an additional assistant in your pain management regimen. Okay, so next we're going to talk a little bit about some herbal pain management. So number one on my list of 4, there are many more than 4 options. These are kind of my 4 favorites that I like to see in herbal pain management formulas. So number 1 is turmeric root, and I'm sure a lot of you are very familiar with that. turmeric root contains many active ingredients, and mostly what we're focusing on are things called curcuminoids or curcumin, and this is an anti-inflammatory active ingredient which helps with pain management. Now, a word on turmeric root. Turmeric root is a very fibrous root. So the active ingredients are, a lot of the fat-soluble active ingredients are firmly bound to the fiber in the root, and these active ingredients are the anti-inflammatory ingredients. So when you extract turmeric root traditionally, it would require cooking it in hot oil with garlic and onions, so like you're making curry. And that extracts and releases that anti-inflammatory ingredient and makes it absorbable. Now, if we use a raw turmeric root or raw turmeric powder and we do water extraction, in other words, if you're making tea or if we're mixing it and making the golden milk, which is basically mixing turmeric with milk, what we're getting is the water-soluble active ingredients, which are your antioxidants, which are fabulous. It has a huge range of antioxidants. However, the analgesic or the pain relieving or anti-inflammatory ingredient is not absorbable in that format. It's not digestible in that format, so you're not going to get much anti-inflammatory if you're using the raw powder. So what you want to look for is either an extracted form of turmeric, like you can get turmeric root extract in capsules, or if you're buying powder, make sure that it's not raw, make sure that it is fermented. The fermentation process breaks down that undigestible vegetable fiber and then allows that active ingredient, that anti-inflammatory active ingredient, to be digestible for us, so absorbable and functional. Otherwise, you're getting loads of great antioxidants, but not necessarily the anti-inflammatory ingredient. Alright, number 2 on my list is feverfew, and its active ingredient parthenolide, which is a significant analgesic. It's also anti-inflammatory and antipyretic, so it can help with fever management too. Feverfew again would be available in tea. You can get them in tea bags, but you can also get them in an extracted form. And if you are really considering using it for its anti-inflammatory benefits, then you really do want to look for an extract of feverfew that has a standardized amount of this parthenolide active ingredient in it, so you can get a significant improvement. Feverfew is most commonly known for helping with managing migraine type pain, so it is quite effective at helping to relieve migraines. Number 3 on my list is ginger root. Now, ginger is one of those ingredients that's anti-inflammatory and pain management benefits. We reap it over the long term, so you really want to be taking ginger root on a regular basis, about 1 gram a day at least. Consistently can help to reduce your inflammatory markers. So when we go for those blood tests and we check for inflammation, if we're consistently using ginger over the long term, it's going to help with reducing systemic inflammation, so not just for one part of the body. So consider incorporating ginger into your daily supplement regime, or at least several times a week, so that you can cumulatively reach those benefits. So ginger isn't something that works for in the very, very short term for acute pain, but it's much better in the long term for more of those chronic conditions. Okay, and then last on my top 4 list is Boswellia serrata, also known as frankincense. So Boswellia frankincense has a fantastic benefit for inflammation management, and especially helping to improve your range of movement, so in reducing the stiffness and tightness in joints, so not just relieving the pain but helping you to move more freely. Now, a note on the essential oil of frankincense. There's lots and lots of information out there a few years ago, and lots of people came in asking me about how to use frankincense oil, because Boswellia or serrata has a huge antioxidant rating. It's a very, very potent antioxidant, so lots of people wanted to take it in the oil form. Now, keep in mind, with essential oils, there's lots of different extraction methods, and not every extraction method is edible. All right, so some of those extraction methods, the chemicals that are used to extract the active oils from the plant are left behind in small quantities in the final product, and it is not edible. It's really only for diffusing, for aromatherapy purposes. So please read your labels very carefully and make sure that the oil that you're buying is actually appropriate for internal use, okay? Because otherwise you can cause some damage to your liver and to your digestive system as well if you use an essential oil that is not safe to ingest. Now, there are companies that make the Boswellia serrata extract in a capsule form. You can get the extract encapsulated, so for sure you're guaranteed that it's safe for internal use. So keep that in mind. Alright, so any number of these herbals can help us with pain management, and the great benefit, keep in mind that they don't have long-term side effects compared to over-the-counter pain medications. These natural remedies may take a little bit longer to take effect, but they have huge long-term benefits and very few short-term or long-term side effects, safe for your digestive system as well. Okay, next we're going to talk a little bit about what pain does to the brain and how the brain can affect pain. And specifically, I want to speak to those people who are suffering with chronic pain. Now, along with chronic pain comes changes in mood, motivation, and people can really find that really gets in the way of them working towards healing. So it's very important to have a positive outlook, but unfortunately chronic pain has a physical effect on our mood. And what we now know also is that if we have depressive symptoms or are feeling low because of chronic pain, that's actually getting in the way of our pain management and our healing as well. So I wanted to introduce you to something called DLPA. It's short for D-L-phenylalanine. It's an amino acid. Now, DLPA helps to decrease pain by blocking the enzymes that break down the body's natural painkillers. Now, our body's natural painkillers live in the brain, and they produce endorphins. And these endorphins help us with pain management. So we want to make sure that we can improve that sense of well-being by improving the endorphin manufacturing in the brain, because this is also going to act on our analgesics. So it's also going to help us with our pain management. So healthy, happy endorphin levels are going to mean better pain management, and DLPA can help with that. There is a dose recommendation. They usually recommend between 1500 to 2500 milligrams of DLPA a day. Now keep in mind, it's not an anti-inflammatory. It's helping your body to manufacture these endorphins so that we can manage our pain better. So DLPA is something that you'd want to consider taking along with your natural anti-inflammatories or your pain management ingredients, and they will give you a better response. It will give those anti-inflammatories a better opportunity to take effect, and of course you will feel more motivated. You will have that better sense of well-being, and your mood will improve as well. The second ingredient, kind of along the same lines in this category of improving mood, is something called 5-HTP, 5-hydroxytryptophan. So this ingredient can be naturally sourced from a plant called Griffonia. And essentially, the recommendation for 5-HTP is about 100 milligrams by mouth 3 times a day, and it can be used for about 30 to 90 days. And within that period of time, you can expect to see an improvement in pain, tenderness, sleep, anxiety, fatigue, and morning stiffness, and especially in people with fibromyalgia. So 5-HTP works on our serotonin reuptake. So serotonin, again, is also part of our happy hormone profile, much like the endorphins, which are working on our natural analgesic management. Serotonin is helping also with our pain management as well as our mood. So a word on 5-HTP. It needs vitamin B6 to be activated, so make sure that if you're taking a 5-HTP supplement, that you're taking your B complex along with it so that it can function optimally. Also, 5-HTP breaks down and becomes inactive in stomach acid. So try and find a form of 5-HTP that has some sort of an enteric coating, so like a protein coating on the outside of the capsule or tablet that will allow it to travel through your stomach and to be released into your intestinal tract where it can do its work. So those are two supplement recommendations that are kind of working on how pain makes you feel emotionally, and that we know that this type of thing is going to have a positive effect. If we can improve how we feel emotionally, then we're going to be able to manage our pain much better. That's all I have for you today. If you have any questions, please feel free to reach out and I'll be happy to respond in further detail. Keep in mind that you can also find me on my YouTube channel, Wellness with Wisdom, or on Instagram at wellnesswith_wisdom. Thank you so much for taking the time out of your day to have a listen to this broadcast. Find your peace, find balance in your life, and find joy.